Hi, I'm Dr. Lydia Dennis, and welcome to my webpage and welcome to my practice. I wanted to take an opportunity today to just talk a little bit about my approach to patient care and how that may be a little different than the healthcare you've received in the past. This should help you make a decision about whether we might be a good match, because I feel like the doctor-patient relationship is sacred, and I feel like that is a relationship that's built upon trust over time, and it's not built in a 15-minute appointment. So let me get started. First of all, I got into medicine to serve people because I love people and I love talking to people and I like having relationships with people. And in regular healthcare, I wasn't able to continue to have long relationships with my patients and get them the time that they needed to explain to me what was going on, for us to develop rapport, and for us to have a truly therapeutic relationship. So first of all, when you come to my practice, I think the thing that sets me apart, especially from maybe experiences you've had in the past, is that I let you talk. I think it's so important that you get to express yourself, that you get to get it all out and tell at least one person exactly what is going on. To me, that's not only therapeutic, it can be cathartic for some people, and it helps me. I need to know everything that's happened before you walked in the door, all the good, all the bad, everything you've tried, everything that's worked, everything that's failed. I need to find out all of that stuff from you so that I can start formulating a treatment plan and we can start working today on what's going to make you feel better. Second of all, I do a pretty thorough workup. Some patients have fired me in the past because I kept finding things wrong with them, but I'm telling you, I really work down to the core of the issue. I wouldn't say that's too necessarily a fault, but I think it's thorough because oftentimes you've gotten just a scratch of the surface workup and there's more to be done. So that usually happens not just at the first exam. That actually happens over the course of time because things will kind of unravel themselves over time, and that's part of the whole relationship and trust piece of the doctor-patient therapeutic relationship. So I do a good thorough workup, and I really am open to thinking outside of the box. Does that mean that I'm going to encourage you to do things that are dangerous? Absolutely not. But I'm open to some new ideas. Oftentimes I have found that patients have taught me. And if they're interested in something, I am certainly willing to research it myself, give you the pros and cons of how I've researched it for you. And if it looks like it's not going to be harmful and maybe even potentially beneficial, I'm willing to give it a whirl. I don't think that most physicians are that open to non-traditional ways of caring for patients. I think that's unfortunate because patients are able to read, patients are able to do their own research. And if I'm unable to give them a professional opinion about that, I feel like that your evaluation and your treatment is probably incomplete. And then I would say thirdly, a generalized way that I approach patient care is through just relationship. The most successful patients that I have are ones that I have genuine rapport with. And that's not just a one-way street. That means that it's not just me pursuing the patient, it's the patient actively pursuing me and having an exchange of ideas. And sometimes that relationship's just like any other relationship. I can speak the truth in love, and sometimes I have to have tough love with some people, but I'm brutally honest, and but I'm also very open to criticism and change myself, and so I think that provides for a good working relationship. I would say that my patients that probably don't get the most of my practice are the ones that are like, I've got high blood pressure, just refill my medicines and recheck my labs every 6 months and I'm good. Those people don't get any better. But if you want to get better, I want you to get better. I want you to see the full benefit of especially a direct primary care relationship. I want to establish rapport. I want there to be a true therapeutic relationship, because once we achieve that, there's trust. And when there's trust, people can be vulnerable with one another. And I find that that is the secret sauce to getting down to the root of most of the problems that people have. And then that's also the secret sauce in helping to have a family practice style relationship, because relationships within families change, dynamics within families change. People are born and people die, and people deal with stressors and all kinds of other things. That's the wonderful, horrible thing about having that kind of relationship. And when people are brave enough to have that together, it's actually really beautiful. So if you have had 15-minute appointments in the past, if you've had your list snatched away from you from the doctor and they've told you better come up with the top 2 today, and you'll have to come back again and again and again to get through your list, maybe this is the practice for you. Maybe I'm a good fit for you. And if you're open to relationship, if you're open to a true therapeutic relationship with your doctor, maybe I'm also a good fit for you. So if you are looking for that style of doctoring, I hope you'll give us a call here. And I hope you'll check out the rest of the information that's on our blog, on our podcast, and all the other educational things that we provide here on the website, our YouTube channel, as well as our Facebook page. Thanks again.